Welcome back, guys, to Iconic Nurse Vibes, and today we're going to be talking about all things yeast infection that not only affects our females but also affects our males. We'll delve right into the causes, treatments, and just how to lay this thing to rest. So let's get started. Let's make it clear that a yeast infection is not caused by a bacteria, okay? It's caused by a fungus specifically called Candida. And this fungus, Candida, can be found in the mouth, inside the vagina, on the head of the penis, and it's also present on our skin, guys. Like, we're all walking around with little tiny, fungi on our skin, and it's fine, it's okay. That's normal. It's okay for it to be there, but it becomes a problem when it grows excessively beyond our control, and that's exactly how we get a yeast infection. In females, it is known as vaginal candidiasis, and in males, it's called Candida balanitis. I know, let's break it down for the males. So Candida, which we already know, is a fungus. Balanitis simply refers to the inflammation of the head of the penis, or the swelling, the irritation of the head of the penis. So I know they could have simply well just said that instead of, but okay, we won't get into it. So who can get a yeast infection? Yeast infection can happen in males as early as around 5 years old, and it's mainly common in males that are uncircumcised, and also in males that have a condition known as phimosis. This is basically where, the foreskin of the penis, it's hard to retract. It's hard to pull back that foreskin, and that's how you can have a yeast infection there. In females, girls can get a yeast infection at any age. However, it's more common in females who are undergoing puberty, because we have that hormonal changes, and also in a female who has undergone puberty already and is on some form of antibiotics. They can, even though they're not sexually active, they can still get a yeast infection. Yeah. It's just another yeast infection. Or is it? Tell me, why is it that each time our bodies try to communicate with us, we instantly just shut it down, silence it with a lot of medications, a lot of home remedies here and there, instead of trying to find out what is the major cause? It is possible for us to reduce the amount of yeast infections that we get on a yearly basis if we are able to implement lifestyle changes. So what's causing the yeast down here? Let's jump into some possible causes. Number one, yeast loves moisture. That's its go-to place. It thrives there. And also, if we wear tight-fitting underwear, underwear that's not breathable, we're trapping all that moisture. Air can't get to circulate down there, and that's just chaos. That the yeast loves that. So if we're doing that, and even spending long periods in underwear that's wet or even moist, and yes, I'm talking to you too, sir. Number two, this is for right. Number two, have you ever received a course of antibiotic treatment and shortly after you end up with a yeast infection?
Oh, pick me.
I know. That's because it's possible that you might have received antibiotic that is not specific. It's like a general antibiotic. These antibiotics are called broad spectrum antibiotics. In the body, we have what is known as good bacteria and bad bacteria, right? So when we get those broad spectrum antibiotics, those antibiotics that just wipe out all bacteria, you have the good bacteria being eradicated in that process, okay? So when those good bacteria are gone, yeast gets its chance to grow. Number three. So hormonal changes. Specifically talking to my females at this point, before and after a menstrual cycle, during pregnancy, if you're currently taking birth controls or any form of contraceptives, those can cause hormonal changes, and with hormonal changes you will have some level of imbalance, hormonal imbalances in the body, and that can result in a yeast infection, because when hormones change, the levels of bacteria in the body will also change. Number 4, a high sugar diet, or if you have a chronic condition that results in you having a lot of sugar in the blood. The most popular one that most persons would know and can relate to is diabetes. It's because yeast thrive, it grows off sugar. That's what it feeds on. If we're doing that, we're basically saying, hey, I'm feeding you, giving you a place to live. Why not just stay? Number 5 is a weakened immune system. So if you, for example, have a cold, a flu, if you have HIV, if anything, any condition or any disease that can result in your immune system becoming weak, you're basically at risk for an yeast infection. Why? Because your body's natural defense system has declined and it's just not at its optimum where it's able to just fight off that yeast infection. So how can you tell if you have a yeast infection? Men and women usually present with the same signs and symptoms, however with just a tiny weeny difference. Let's start with our males. The head of the penis can look very red. The penis can look red. It may be itchy and also present with a rash. You might notice an abnormal discharge, like a white, thick discharge. And most persons would describe that as cottage cheese, like food, but okay. You might have a little burning on urination when you're urinating, because that pee, if it touches the head of the penis, it can be very painful because the skin is already inflamed. For men who were able to pull back the foreskin, they might realize that it's really difficult for them to pull back that foreskin because the skin around the head of the penis is also inflamed. Now for my females, you might experience intense, extreme itching. The vulva might appear swollen and inflamed, red. And when I say vulva, I'm talking about the external portion of the female genitalia. Burning on urination, similar to the males, you can have the same discharge that resembles that of the cottage cheese. In most cases, the discharge does not have a scent. The fact that we know the causes, some causes of a yeast infection, that means we can work towards preventing them, right? So wearing underwear that's breathable, that's not too tight. I know we like to look sexy and all that little stuff, but not for long periods. Please, let me come close. Both male and female, when we take a shower, we want to ensure that we are drying that area properly, and we want to pat dry. For our men, listen up. When we take a shower, when we bathe, you're gonna ensure that you're pulling back that foreskin, okay? Don't be afraid, it's here and touch it. Pull it back. And we wanna ensure that we're drying that area, okay? The next thing we can do is reduce our sugar intake. I'm not saying to completely eliminate sugar out of the diet, but reduce. Come on, we can drink a little tea in the morning without sugar in it, right? But it's gonna... I never asked you how it's gonna taste. I was just telling you that it's something that we could possibly try, okay? Stop douching. Ladies, the vagina has the ability to clean itself. That's a superpower that we all possess. It does not need you and you and you to help. It didn't ask for it. Just stop. There is a lot of misconception and misinformation spreading, and what works for Pam, Janella, Josie, Rosie, listen, it might not work for you. When you douche, you're basically disrupting the normal balance in the vagina, and with a yeast infection, girl, it's already disrupted and you're making it even worse. Exercise, that's the next one. So we can exercise in order to try and prevent a yeast infection. And how this works is that in the body, when we use our muscles, we use up what is known as glucose. All right, simple terms. Sugar. You're using that up, and that's what the yeast actually needs to grow. I know some persons are gonna be saying, oh, but if you sweat, if you exercise, you're gonna be sweaty, and then sweaty's gonna... But here's what we can do. Immediately after exercising, if possible, we can take a shower. If not, bring an extra pair of clothing or underwear just to change off, so we are not stuck in that moist, wet undies. Add some probiotics. We can eat some yogurt. And hold up. And don't be adding any down here. It didn't tell you that it was hungry, at least for that. Adding probiotics to your diet can basically help to add back that good bacteria in the body, so it can help to regulate or even to control yeast. Sometimes we will know when we are having a yeast infection because our body will communicate that to us. Some yeast infections are mild, and as a result of that, you may not need medication for it because the body can basically deal with it on its own. Before you do anything, listen to your body. If you realize that the symptoms are getting worse or you're experiencing something and you really don't know what's the cause of it, consult your healthcare provider. Some medications can be received over the counter and others have to be prescribed by your physician. These medications are classified as antifungal medications, and they come in the forms of pills, creams or ointments, and for my ladies, suppositories. Some examples are fluconazole, also known as diflucan, nystatin, meconazole.
One more thing.
If you have more than 4 yeast infections in 1 year, it could mean that you have what is known as a complicated yeast infection, and in that case I really recommend for you to see your doctor.
One more thing.
I'm just messing with you guys. That's the end of this video. I really hope you enjoyed it, and until next time, oh, if you have any questions, I'm open to questions. Okay, ask your questions, I'll be willing to answer. Until next time, keep safe and always find something to be grateful for. Spread love. Bye bye.